Hi everyone. On behalf of the administrator and all the department heads, we want to thank you for your response and participation to the first all staff in service via YouTube. We have 101 views so far. For today's in service, we are going to talk about prevention and control of infection. Specifically, we're going to describe the new screening form that has been implemented since yesterday. As you might notice, the new form includes new symptoms added by the state of California. Specifically, is if you are having chills, repeated shaking with chills, muscle pain, headache, or new loss of taste or smell. Every time you come to work, you have to be screened outside the building. I'm sure you notice, most of you notice the new canopy outside, a table, and somebody will be screening you. In the morning, the person will be from 6:40 a.m. to 8 a.m. and from 2:40 p.m. to 3:30 p.m. The staff coming early in the morning, specifically the kitchen staff, will use the radio set up on that table, and there is a little yellow bucket. Could be inside the bucket, and you are going to call the nurse on duty to inform that you are here and you need to be screened. Please make sure that they copy you when you call them. Just ask if they copy to make sure that they are aware that you are here. Also, you need to wear a mask prior entering the building. If you have no mask with you, the screening will provide you with one. For the night shift crew, the process to be screened will be similar to the early morning crew. For those who come after regular study shift hours, for instance, those coming from other jobs, please page the nurse or CNA assigned as a screener to go over the screening procedure. By state guidelines, our facility should have only one door or spot to get in and same door or spot to get out. Only the emergency transportation personnel, such ambulance and firefighters, as well as new admissions, residents with doctor's appointments, and drivers will be allowed to use the front door. No one will be allowed to exit through the front door, even if this person is leaving for the day, checking for something in the car, or buying a snack at the gas station across the street. To all the department heads, if you are expecting a vendor's visit, make sure they are aware of the mandatory screening procedure. Please continue to the great job wearing masks prior entering the building, alcohol-based rubbing hand sanitizing before entering and when leaving a room. Wash your hands if visible soiled. Some clarifications. After the morning or evening assigned screening have left, the Station 2 nurse will delegate a CNA to screen employees that come in between those hours. We have to understand that we cannot keep one person 24/7 outside to screen you. So we are covering only the peak hours, which will be, as I said before, 6:40 a.m. to 8 a.m. in the morning and 2:40 p.m. to 3:30 p.m. in the evening. We are going to keep that radio outside, and after the last person at the night shift came in, please, nurse or CNAs, get the radio inside the building, and we have the charger in station 2. The next day around 5 a.m., the night nurse will put the radio out again and have it ready for the kitchen crew that is coming between 5 a.m. and 5:30 a.m. We are trying to be in compliance with the state of California and the CDC with all the guidelines that they are sending very often, basically every day, to the administrator, and he shared that information with us. So far, we had to ask 9 of our employees to stay at home for a period of time due to a contact or exposure that they had with another facility. So we are trying to really keep everything right, and trying to follow the instructions that we were given. At the same time, we ask you to do your part, and using the mask and the hand sanitizing is very, very basic. Now we are going to do a demonstration of donning and doffing PPE. And when you are donning PPE, begin by checking which PPE is required by reviewing the sign is outside the room. To reduce risk of transmission, ensure hair is pulled back and jewelry is removed or minimized. Start by performing hand hygiene for 15 to 20 seconds. Rub your palms, wrists, in between fingers and thumbs, back of hands, and along the nail beds. Alcohol-based sanitizer is the preferred method. You may use soap and water when hands are visibly soiled. Don your gown by first closing the back of the neck. Then tie the waist, ensuring all the clothing is covered. Place your mask over your nose and under your chin. Place the strap over your head. Mold the nose strip to ensure a secure fit and tight seal. Put on gloves one at a time, making sure they cover the cuff of the gown and no skin is exposed. When doffing your PPE, remove the first glove by pulling it up and away from the middle of your palm ensuring no skin contact. Hold the glove in the other hand. To remove the second glove, place a finger inside the clean area of the glove and push it off, balling up both gloves together. Throw them to the garbage. Remove your gown by first opening the neck. Then at the waist. From the back of the neck, take the gown and slowly pull it out and away from you. Ensure you are only touching the inside of the gown as you roll it into a ball, and then throw it to the garbage. Perform hand hygiene from 15 to 20 seconds. Then remove your mask without touching the exterior part of the mask. Place index fingers under the strap, pulling away from you, place it into the garbage. Perform hand hygiene again. And this is the way to do the most common donning and doffing PPE. And just in case we have different kind of contact precautions, we'll do a special in service according to the needs. So basically, we just want you to keep the good job and keep doing what we are required to do in order to keep our place safe. I thank you very much in advance, and I hope you enjoy this video, and it'll be great if you subscribe to the channel, and in the future that it'll come automatically in your device. Thank you very much and have a wonderful time.